Hi, Dr. Paul. I want to talk about depression, probably the second most common thing I see after anxiety disorders. And depression is it's something that obviously people are suffering with when they have it, and it comes in different types. There's major depressive disorder, there's minor depressive disorder, there's dysthymia, which is a very mild depression. But depression in any form is uncomfortable. Feelings of apathy, worthlessness, hopelessness, sad mood. A very common symptom is called anhedonia, which is the most sensitive symptom, which means lack of interest in doing what you normally like to do. For example, if you like to golf, but you don't want to golf. If you like to surf, you don't want to surf. So it's things like this that are normally bring you pleasure in life, and they just feel like too much work and I don't want to do it. It just, so that there's something wrong when someone is feeling what we call anhedonia. But there's problems with sleep. There's problems with sometimes suicidal thoughts. Sometimes people have those passing thoughts. So all of these are very serious symptoms, and it's a very serious condition which I treat a lot of. But the good news is there's hope. The hope is that when they get the treatment, when people get the treatment they need, it's amazing the turnaround. And I talk to people about things like exercising, which is important if they have the motivation to. Sometimes they're just too sad and unmotivated and they just can't do it. We talk about counseling if needed. That can be helpful. But my specialty is medications, and the medications are remarkable what they can do for these conditions. They basically restore balance in the person's system. And if we look at the nervous system, the basics are neurons communicating with each other constantly. There's over 100 billion nerve cells. Chemicals are traveling around the system about 1,000 times a second around the body, from cell to cell, constantly flowing in a one-way, supposed to be a one-way direction. And that's the problem. And then when we looked a little bit deeper at the cell and the bigger picture of them, there's different receptor-sized little holes that the chemicals pass through. We got serotonin, we got norepinephrine, we got dopamine, we got GABA. So we got different chemicals that are supposed to be going in each: serotonin, norepinephrine, dopamine, and GABA. That's what's supposed to happen. They're supposed to be moving in a one-way direction at all times. And sometimes what happens is they lose the connection happens. So leakages develop that causes these chemicals to go the wrong direction. And that's what we call neurochemical imbalances. And they start going the wrong way. So why does it happen? The main reasons are genetics, runs in families, number one. Number two, it changes with hormone changes like puberty, menopause, postpartum, like postpartum depression, a PMS for women, and then stressors. Sometimes people get depressed when they lose a loved one, when they lose their job, when they there's a lot of financial problems going on in this country. So there's a lot of reasons why people get depressed, and then the pandemic didn't help. Then that's people have had anxiety issues and depression, which worsened because of the pandemic. And so there's a lot of reasons, but those are the key reasons why. So how to fix it? So basically, I look at the most basic two neurochemicals, serotonin, norepinephrine. Again, most doctors believe SSRIs are the best, which stand for selective serotonin reuptake inhibitors. So they inhibit the reuptake of serotonin. The problem with that, and then every doctor except me that I know of thinks that these are the best to start. And that basically you get serotonin going that way, and that's good. But the problem with just working on serotonin is it can make you feel flat, apathetic, sexual side effects. Not with everybody, and I do have some people on them, but that's the problem, is they're not the best first-line agents like most doctors think they are. The best first-line agent is an SNRI, serotonin and norepinephrine reuptake inhibitor. SSRIs you might recognize, like Prozac and Lexapro and Zoloft. SNRIs, there's Pristiq, there's Effexor, there's Cymbalta. Why are they better? Because they're balancing two chemicals instead of one. And then when that happens, typically less side effects, better energy, less sexual side effects, if any. better focus and concentration. So it's just a better product usually. And how often does that work by itself? It can. Very often, though, it's not enough, and then very often I need to add a second agent. Some people, one thing alone, and they're good to go, and they're great, and they're back to themselves again. The depression is completely lifted. But let's say we get the depression halfway better. That's fine, but it's not enough. So that's why I work on the chemical dopamine. So always look at dopamine, because dopamine is tied into motivation, energy, drive, focus, happy, positive, energetic. It gets rid of any sexual side effects. If the first one is causing that, then that getting dopamine. And people have heard about the dopamine high. People get dopamine high when they do sports and when they exercise and whatever. There's a lot of things that can cause a dopamine high, but it gets your natural dopamine moving normally. What I call SNRI, like Pristiq is my favorite, with Wellbutrin and then DRI, norepinephrine, dopamine reuptake inhibitor, I call the dynamic duo, because when you put those together, you got all three, boom, 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 all three of them are firing. And that's sometimes all it takes. That's the combination is very effective. Many of my patients are on those two medications. That's all they take, especially if the first one isn't good enough. Then we have GABA. So some people have a more persistent depression that's still not better. So we add something for GABA, like Lamictal is a common one I use. That's for a tougher, more of a bipolar depression. So it's a bit of a tougher depression if I add Lamictal in there. And sometimes I'll add other medications to help with depression. Like some of the we call antipsychotic medications, which I use for other things beside psychosis, obviously. But sometimes I'll add that to have a boosting effect for depression. But we're probably dealing more with the bipolar realm with those, and more, like I said, bipolar depression, which is still a depression, but it's a tougher depression to treat. So, but the good news is that whatever I'm very good at figuring this out very quickly. I normally takes me no more than 1 or 2 visits to get this figured out for people. And they once they're doing well, they feel back to themselves again. They feel like they want to go do things again. They want to socialize with their friends, and so it just the restoration of self is what I'm looking for. Is that when people tell me I'm me again, I'm back to me, that's a success story. Unless I'm there, and if someone says I'm 75% of the way there, that's still not good enough, because I'm wondering what else is going on, and I might add something else. Sometimes it takes 3 things, but so what? It doesn't matter how many things it takes. It's just a matter of what matters are the results. And then this becomes a life restored, and usually it doesn't take me no more than 2 visits, sometimes 3, to get this figured out. So the good news is there's hope. You don't have to be depressed. If you're suffering with it, come and see me. I talk about depression in my first book a lot. I have a whole chapter in my first book, Healing the Mind and Body, of the series of first 3 series of books I wrote. I have a whole chapter about depression in my new book, The Corona Protocol, with 2 stories. It's a storytelling book. So I tell in my depression chapter, I tell about 2 different people with depression of different types. So if you want to check those out, I recommend them, of course. So anyway, I hope that helps explain depression. And thank you so much for listening.